Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Stephen Newmark, Director of Policy at the Global Healthy Living Foundation.
And I'm Zoe Rothblatt, Director of Community Outreach at GHLF.
Our goal is to help you understand what's happening in the healthcare world, to help you make informed decisions to live your best life.
And today we're joined by Shonta Chambers with the Patient Advocate Foundation. I had a really wonderful conversation with her about the work she does at Patient Advocate Foundation to improve health equity and connecting patients with resources for all things that go into their health. We talked a lot about health disparities and how things like transportation and your housing impact your health. So, Stephen, I'm excited for you to listen.
Yeah, well, let's get into it.
Welcome, Shonta.
Thank you so much, Zoe, for having me. Excited for today's conversation.
Me too. Why don't you start off by introducing yourself to our listeners?
Hello, I am Shonta Chambers, and I'm the Executive Vice President for Health Equity and Community Engagement for Patient Advocate Foundation. I am also a mother of two amazing young men, and I'm a caregiver for my mother who is living with progressive multiple sclerosis and my father who is actually a stroke survivor. So I get to be an advocate in my profession and as well as being an advocate in my personal life. So that's a little bit about me.
And can you tell us more about your work with Patient Advocate Foundation and how you advocate on behalf of patients there?
So, Patient Advocate Foundation, as an organization, we're really at the nexus of addressing access and affordability issues for persons living with chronic and complex health conditions across all 50 states. And that is really bringing to the forefront those various social and financial drivers of health and health inequities that people are living with every day. So, it's really about looking at insurance and helping those who may be uninsured identify and enroll in a health insurance plan, or for those persons who may be insured and have a course of care that has been denied, working with them to actually file an appeal against that denial, or for those folks who are just really needing financial resources to address everyday cost of living expenses like utilities, rent, mortgage, even groceries and transportation, to even things such as helping folks actually apply for or Social Security disability. So it's really addressing everything across the spectrum of health and across the spectrum of healthcare, but more so focused on those social and financial aspects and less of the actual clinical aspects.
And can you tell me more about that, how those social and economic aspects impact your health? I have a background in public health and policy and management, and we always talk about social determinants of health, and it might surprise people to learn how much these other factors, like you're saying, outside the clinical impact your health. And can you tell me about more about that and what you've seen in the patients you work with?
So there was a study done some time ago, and it really outlined the fact that 80% of one's health outcomes are actually attributed to these social drivers of health or these social drivers of health inequity. And that includes things such as where they live, their economic status, and all of these factors, like you pointed out, that are all non-clinical based. And so it's really about understanding when someone is uninsured, how that hinders their ability to access and adhere to care. If someone is underinsured, that hinders their ability to access and adhere to care. If someone lives in a food desert, and let's say that there's a course of care that requires them to have a healthy diet, that impacts their overall quality of life. Let's say that someone lives someplace where it's a transportation desert and they don't have adequate transportation, then it also hinders their ability to be able to access care. Because if someone has to travel 2 or 3 hours to get to doctor's appointments and back and forth, etc., how that does have an overall impact on their overall health. And also for those people who may be living in dilapidated housing or those folks who may be housing insecure. I think it's so important for us to understand that what homelessness looked like several years ago, which was basically, we always have this vision of homelessness of people living on the street, that now we have a new definition of homelessness. We have new characteristics of homelessness. And right now what we're seeing is a lot of people who are living in these long-term care lodges or these long extended stay hotels. And these individuals are actually classified as being homeless. So these are all of those other factors that we really have to think about because they have a significant impact. That is why it's so critically important that we have active conversations around these things, but also make sure that we're having these policy discussions around these things as well.
And what sort of policies or resources do you promote as a foundation? Like if a patient calls you up and let's use your example of transportation that they need help. Can you walk us through like how you would help that patient and what you offer?
Absolutely. So let me start by saying that we have a cadre of amazing case managers, and they are some of the most passionate and hardworking individuals that I have ever encountered. Not just our case management team, but also our team that works across our entire enterprise, from our co-pay assistance program to our financial assistance program. And so let's take this example. Let's say that we do have a patient that comes to us and they've identified transportation as a barrier. Let me also point out that it's so critically important that the patients that are coming to us never come to us because they just have one challenge. So that patient who's coming to us may be coming to us because they have an immediate transportation barrier. But because our case managers have been in this space for so long, they know that once they begin to ask more questions, they're going to find that there are more layers to this onion. So not only does that person have a transportation problem, they may have some difficulty paying for their utilities. They also may be experiencing difficulty paying for their medication. So, on that transportation situation, what that case manager is going to do is look to see if he or she can actually find resources at the community level or someplace else to really be able to respond to that transportation need that that person may have. The beauty of them doing this further exploration around the needs of a patient is, let's say that they can find a viable transportation resource, but they do know that this person is also having some challenges paying for medication or actually paying for their utilities. But in those two lanes, they may be able to find a viable resource. So, what they may do is find that viable resource to address that medication cost issue or that utility issue in the hopes that that will free up some additional resources within the home that now this patient can direct towards addressing that transportation barrier. So they are really some geniuses in this space and really navigating. So it's like if they can't find a solution to one thing, maybe if they can find a solution to something else, then it can help work with that patient or that caregiver who may be calling us on a patient's behalf to reallocate those resources to address the need that they may be calling us about. But that is only once they've exhausted all possible options. And that's what they do every single day.
And I think what you guys do is so incredible because it's just so exhausting being a patient. And like you're mentioning, there's so many aspects to focus on. And to know that someone can call you guys up and get that help. And maybe you're asking questions that they haven't even thought about themselves because you're just so overwhelmed with the chronic illness. And it's amazing that you can take away that burden from a patient and be able to support them in a time of need.
Absolutely. We actually just completed a survey to really look at administrative burden. And those results, of course, can be found at our Patient Insight Institute. And it was just really amazing to elevate the urgency of minimizing the administrative burden that patients encounter, as well as their caregivers, because it can sometimes take weeks and months and sometimes years to bring resolution to some of the challenges that they are experiencing. And I think it's the reality that we have to understand the urgency of now. So when patients or caregivers who are coming to us on their behalf are seeking assistance or seeking help, they're needing it like now, not 3 months from now, not 6 months from now, and not a year from now. And if I can call out, when we talk about patients who are living with rare diseases, we're talking about that disease odyssey even being much longer. And so it's just critically important for us to also understand the enormity of the administrative burden that is also on the shoulders of patients. So they're trying to balance the administrative requirement to get assistance for things, while at the same time, they're also trying to manage their condition. And that's a balancing act that I don't think any of us desire.
And maybe this is too personal, but do you ever feel that burnout with doing it every day in personal and professional life?
Absolutely. I'll use my mom for an example. So, my mom is bedbound as a result of her MS. And there is a program in the state where I live that allows persons who would qualify for skilled nursing care to be able to receive that care in their home. So, one of our case managers told me about this program back in 2022. August of 2022 was actually when we started this process. We are now sitting in March of 2024, and I am still trying to get her the first day of in home service. And so I consider myself to be somewhat intelligent on most days, right? And so here I am trying to navigate the system and I'm having these significant delays. And I do this, or I'm in the space with people who do this every single day. And I don't think we sometimes realize the emotional and mental toll that this can even take on a patient or their caregiver or whomever. We're talking about 2022, and here we are in 2024. And fortunately, I am able enough to be able to care for my mom. But what if I wasn't? And then on the other side of that, I still have to work every single day. And so, what about those folks who don't have that type of social support system? What do they do? And oftentimes, you know what they do? They just give up. And that's not right. That's just completely unfair.
Totally. And I think a huge part of this too is the health literacy. So because of your work, you know all the right questions to ask and you know what words to use, and you're still confronted with the barriers and the delay. And I'm just thinking about all the people that don't do this every day in their life and are just so confused when they pick up the phone and really just don't know what to do, not by any fault of their own, but just because you're learning as you go in a lot of these healthcare scenarios.
That's the beauty of what I appreciate about how PAF as an organization approaches our engagement with patients. And so going back to our case managers, whenever there is a moment to do a conference call with a patient or their caregiver, when we're trying to bring an issue to resolution, we use that as a teachable moment. So they use a lot of three-way calling so that that patient or that caregiver can hear the questions that they're posing. They can also hear how they're responding to questions that are being asked of them. And we use those as teachable moments so that if individuals ever find themselves in these situations again, they at least can draw back to what they heard in terms of how our case manager may have posed a question or how they may have actually responded to a question. Basic literacy in our country is still a challenge. And so when you add on top of that health literacy, it just becomes a greater challenge. And so being able to use these audible opportunities as teachable moments is also a way how we try to really build self-advocacy among our patient population.
And what are some of the other common challenges or lack of resources that you see in your work?
Housing.
Yeah.
Housing has been a huge challenge in terms of affordability. With everything that has been happening, housing has really risen to the top for so many individuals. And housing is critically important for a number of reasons. Imagine the anxiety associated with not knowing that you have safe and secure and stable housing, especially if you're someone living with a chronic or complex health condition. So, housing would be one of those things. And then again, for those who are still able to maintain their housing, everything that goes along with cost of living. So, cost of living continues to be one of those major issues that we hear from our patients all the time. And I'll round that out and say costs associated with care, whether that's direct pharmacologic costs or costs associated with having to travel to care, copays that are associated with their care. Those would probably be the three. Like I said, housing, of course, the ability to afford cost of living related expenses and cost of care related expenses. That is what we hear most often from the patients that we serve.
Yeah, it's so hard because a lot of just what you would call healthy people are dealing with these challenges. And then when you're managing a chronic disease, which I always say is a full-time job, it really requires so much. And then when you physically don't feel well and you just want to curl up in bed, but you don't have a bed. You don't have access to reliable comfort to take care of yourself. It feels like that should be a basic human right.
Right. So if I go back to that example, when I think about the new face of homelessness, when I said people are now living in these long term care hotels, these kind of quad living environments, and probably you're talking about a space that has one of those little cubic refrigerators in it that for those of us who are fortunate enough to be able to go to college, they were in our dorm rooms, right? And so it was enough to maybe keep maybe some water in, maybe one or two snacks. But for let's say if you have someone that is on a therapy of any type that needs to be refrigerated, or someone who, again, needs a healthy diet to accompany their therapy, how much of a healthy diet can you store in one of those itty bitsy tiny cubic size refrigerators? And then for those who have to store medication, you're having to balance how much of that space is used to store your medication, as well as how much of that is used to store your food and things of that nature. And so when we talk about it in that context, we cannot ignore the relationship with health and housing as we think about what it looks like for people as they move forward.
I'd never even thought about that, just the attention to detail and how you move through the day. And as something as simple as the size of a refrigerator could dictate your health and how often you have to get up and go to the store, and just the privilege there to even visit the store every day and trying to maintain a job. And it's just so layered when you really dig deep.
And so that's making the assumption that there is a store that
Mm.
you can get up and go to, right? If we think about so many of our communities, the major market is Pinky's convenience store. And the closest thing to a fresh fruit and a vegetable may be that banana that's been sitting on the counter all week. And so when you start peeling this onion back a little bit more, you say, yeah, I may be in a long term housing situation where my frequency to need to go to the grocery store is great. But guess what? I don't even have transportation to be able to get to the store because there is not one in walking distance of where I'm having to live. So it becomes this amplifying effect. And then think about really the emotional toll that that has on one. As you said, sometimes you're so physically exhausted from trying to manage your condition and all of those things that you just want to curl up. Well, so many people can't curl up because they realize if they curl up, that the family members that are depending upon them, they lose as well.
So, what can we do to help? That's such a broad question, but are there policies we can advocate for? And like the individual level, how can we support our community? What suggestions do you have?
One of the things, and I've taken this learning environment, this learning opportunity with my mom and saying, how can I make this easier for the next person? And so I've been documenting just my own experience through this with a plan to give back or give guidance back to my local legislator. This is my story. So I think to degree, all of us have a story, whether we are a patient or whether we're a caregiver, we have a story. And it's important for us to tell that story to the individuals that we are electing at a local level as well as at a state level, because they are the face of us as constituents. And so it's critically important that they know when they're making decisions around healthcare, when they're making decisions around transportation infrastructure, when they're making decisions around housing, when they're making decisions around these state funded safety net programs, they need to understand that there are real people at the end of these types of decisions. There are real families at the end of these types of decisions. And we can't just say that to them one time. We can't just say that to them in an election period or an election time of year. We need to be constantly using our voice and creating an echo chamber, because just like we know, I know my mom and her living with her MS. I know my dad and him being a stroke survivor. But when we walk out of our door, we know other people in our community, whether there are seniors in our community that are experiencing challenges when they're only trying to live the best quality of life possible. So we have a responsibility and an opportunity to be that echo chamber, to raise these voices, to raise these issues so that they don't fade away. What tends to happen is around election time, everyone wants to talk about these things. But once the polls close and the final ballots are cast, then all of these conversations become mute. But they don't become mute in the lives of persons living with chronic and complex health conditions. They live with this 365 days a year. There are no off days. There are no primaries. There are no final votes. This is their life every single day. And we have to make sure that these experiences don't fade to black, that they continue to be vibrant in the forefront of how we deliver healthcare every single day.
Well said. Keep the story alive and remember that it's real people. It's really powerful. And sometimes I say we're all just one chronic disease away from getting a chronic disease. Like, you never know. It could be you. I live with two chronic diseases, and it's a turning point in your life, and everybody has issues they care about. And there's a lot of issues we talked about today that I think it should resonate with most people, whether it's the housing, the transportation, the healthcare, the being a patient yourself, caregiving, health literacy, regular literacy. Like there's so much here that you can have a personal connection to.
Absolutely.
Shonta, the final question I wanted to ask you is what advice do you have for other caregivers?
Oh, wow. What advice would I have for other caregivers? Two things. I would say first, I would have to express my appreciation for all the fellow caregivers out there because they are such unsung heroes because no one sees their tears or hears their cry. And oftentimes it is in that space of us being with ourselves that we allow that to take place because we don't want to do it in front of the person that we're caring for because they already are dealing with the emotions of knowing that we're having to render care for them. But at the same time, it's the humanity of who we are because it does get exhausting. And if you are a caregiver who also may be living with a chronic or complex health condition yourself, it's only amplified. And so for me, my advice to caregivers is don't forget to take those moments for yourself to just reset, reframe, and then re engage. And know that it's okay to say that you are tired. And it's also okay to say, not today. It's okay to say that today I'm not going to deal with that one thing. Not today, because you're only as good as your strength. And it's all right to take those moments to restore your own mental health. So find out what that means for you and be okay with resting in that place.
That's really beautiful. I think it's similar to as a patient, your whole identity doesn't have to be a patient. And I'm sensing that from what you're saying as a caregiver. It doesn't have to be your whole identity. And your advice to take time for yourself helps you maintain that you're like a person first and a caregiver second.
So, what do we always say? You can't pour from an empty cup.
Yes.
And so, as a caregiver, it is so important to make sure that you have someone or something or some space that fills your cup so that your cup doesn't run empty.
Well, thank you so much for joining. And I guess my final question is where can our listeners find you, find Patient Advocate Foundation? We'll drop some links in the show notes, but let us know.
So, of course, you can find Patient Advocate Foundation at www.patientadvocate, that's all one word.org, or you can reach us toll free at 800-532-5274. You can find me as well as Patient Advocate on LinkedIn. Of course, I'm at Shonta Chambers at LinkedIn. And there are a plethora of resources on our website. So we have a phenomenal National Financial Resource Directory on our website, which is really a catalog of all the resources across the country that our case managers have tapped into, because we realize sometimes it's 2 a.m. when you realize you need a resource, and when you can't call someone. We wanted to make sure that there was a space that patients could go to, caregivers, or even those who are in communities that are helping to support patients. So you can find a variety of resources there on our website.
Thank you so much for joining us and for all the work you do. I'm excited to follow along your journey and keep seeing how it goes.
Oh, well, I'm not tired yet. I keep my sleeves rolled up because this is truly a marathon and not a sprint. And I'm ready for it. So I stay hydrated and stay rested because there's a beauty in this work called advocacy. Although I wish I didn't have to do it, but I think we all have a purpose. And I think that this is part of my purpose.
Amazing. Well, thank you so much.
Thank you so much, Zoe.
Wow. Well, that was great, Zoe. It was so interesting to hear from Shonta.
Yeah, that was really great. I really appreciated her talking about caregiver support and just the burnout there and the need to think about the other players in the healthcare field. How about you? What'd you learn?
Yeah, speaking about learning, that was a big learning for me, just the idea of what caregivers go through. I've seen it on a personal level, how emotionally draining it can be and exhausting to be a caregiver. And our hats are off here at GHLF. We never neglect caregivers, at least I hope we don't. So we salute them. Well, we hope that you learned something too. And before we go, we want to encourage everyone to check out all of our podcasts at ghlf.org/listen.
Well, everyone, thanks for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you liked this episode, give us a rating, write a review, and hit that subscribe button wherever you listen. I'm Zoe Rothblatt.
I'm Stephen Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.